Are therapies covered? Catherine is a 15-year-old who recently had hip surgery. Her mother questions whether her health insurance will pay for physical therapy. Catherine's mother asks her attorney whether therapies are routinely covered by health insurance policies.
One of the concerns about health insurance for a child with a disability is whether the coverage will allow for all the kinds of therapy and care that they need. Yes. Some insurance coverage is fully covered for that student, but some policies will only cover therapies that are approved by the doctor and are not provided in the school setting.
For Catherine, who recently had hip surgery, it was possible to arrange for insurance payment of a limited number of physical therapy sessions. This was because Catherine's orthopedic surgeon wrote on the prescription that the goal of treatment was perioperative recovery and that therapy would focus on pain management. These are clearly medically related indications for treatment. Insurance companies often do not cover payments for ongoing therapies that focus on long-term functional goals, such as transfer technique or therapeutic ambulation. These therapy goals are considered education-related. As children enter middle school, however, direct physical therapy services are often cut back considerably. This is because many districts determine the education-related physical therapy goals have been met by the time children become teenagers.
Insurance is complicated for everyone nowadays, not just people with disabilities, but for some reason it seems to be even more complicated for people with disabilities as to what is covered, when you have to seek application for additional coverage, or whether or not they're going to be covered on the basis of being a student.
It is important to ask that physicians specify clearly why therapy services being prescribed are medically necessary. It is also important to check with the insurance company whether additional applications are needed, so that health insurance coverage includes all medically necessary therapy services. Catherine's physical therapy sessions allowed her to make a full recovery and were medically necessary for the long-term success of her hip surgery.